Hello there. If you're a parent of a baby or a toddler, you know that there is nothing, and I mean nothing, more stressful than hearing your little ones struggle to breathe. So today, we're going to talk about a really common cause of that stress, bronchiolitis. The whole idea here is to give you clear, reassuring info so you know what's going on, what you can do about it, and exactly when you need to ask for help.
So, picture this. It starts with a little sound, maybe a cough, and then you hear it. That faint, whistling sound when they breathe out, a wheeze. And your mind just goes into overdrive, right? Is this serious? What do I do? It's a totally normal reaction. So let's break down what's likely going on here. All right, so let's start with the absolute basics. First things first, what even is bronchiolitis? Understanding the what and the why is honestly the best way to feel a little more in control and a lot less anxious. Okay, so what are we talking about here? I want you to imagine that your baby's lungs are full of tiny, tiny little straws for air to pass through. They're called bronchioles. Well, with bronchiolitis, those little straws get swollen and, you guessed it, clogged up with gunk and mucus. And that makes it way harder for air to get in and out, which is what causes that wheezing sound and that fast breathing you're seeing.
And what's behind all this? This is a really, really important point. Bronchiolitis is caused by a virus. It's not bacterial. A lot of the time, it's a virus you might have heard of called RSV. And this is so crucial because it means antibiotics are completely useless against it. This is a bug your baby's own amazing immune system has to fight off. So who gets this? Well, it is overwhelmingly an illness of the very, very young. We're talking mostly about babies under a year old, and it's especially common in those under 10 months. It's simply because their airways are so tiny, they're just more easily blocked by all that swelling and mucus. Of course, hearing a wheeze can make your mind jump to some scary places. But, doctors have ways of telling the difference. Bronchiolitis pretty much always starts out looking like a common cold. That's way different from, say, the super sudden trouble breathing you'd see if a child inhaled a piece of food. And while it might look a little like asthma, bronchiolitis is a specific viral infection that happens in infants. Okay, now let's talk about the journey. How does this illness usually play out? Honestly, knowing the timeline can be a huge relief because it helps you know what to expect and where you are in the whole process. Here's what a typical case looks like. For the first day or two, it just seems like a regular cold. Runny nose, maybe a little fever, a bit of a cough. But then, right around days 3 to 5, that's when things usually hit their peak. This is the toughest part, for sure. The wheezing is at its loudest, the breathing is fast, it's rough. But after that peak, things almost always start to get better. Now, the cough might hang around for a few weeks, but the really severe part, it's usually pretty short. So, you know what it is, and you know what to expect. Now for the most important section of all. What can you do? What's your job here? And the really good news is that almost all babies with bronchiolitis can be cared for safely right at home. But before we get to our to-do list, let's be super clear about the don't-do list. And this is the big one. Because it's a virus, there is no magic pill, there's no medicine, and especially no antibiotics that's going to cure it. This is all about supportive care, just making your baby comfortable while their body does the hard work of fighting off the virus. And that supportive care? It's actually pretty simple. First, just try to keep things calm and encourage rest. If they've got a fever and seem miserable, a little paracetamol can really help. It is absolutely vital that the air they breathe is clean, so a smoke-free home is a must. And finally, your number one job, fluids, and more fluids. Let's just park on that last point for a second, because it is the most important thing you can do. When a baby is working that hard to breathe, they get exhausted, and they often don't want to eat. That's how they can get dehydrated, and that's the number one reason a baby with bronchiolitis ends up in the hospital. So your goal is to offer smaller feeds, but more often. Try to get in an extra bottle or two's worth of fluid over the day. That is your mission. Now, while most babies do just fine at home, it is so important to know the warning signs, the red flags that mean you need to pick up the phone and call a doctor or head to the hospital. So let's go through a really clear checklist. If you see any of these things, it's time to get help right away. Is their breathing getting harder, not easier, after that day 5 mark? Look at their little chest. Are the muscles between their ribs sucking in with every breath? Do you see any bluish color around their lips? Are you noticing fewer wet diapers? And just how do they seem? Are they getting really tired or floppy or just not themselves? You have to trust your gut. If you are worried, you make the call. Period. Okay, you made it through. Your baby is feeling better, and you can finally breathe a little easier yourself.
but it's totally normal to have some questions about what this all means down the road.
A really common question is, oh no, are we going to have to go through this again? And for the huge majority of babies, the answer is no. Bronchiolitis is usually a one and done kind of illness. For most kids, once is enough.
And now for the big one, the question that I know weighs on so many parents' minds after their baby has gone through a scary wheezing illness like this. Does this mean my child is going to have asthma?
And the answer here is incredibly reassuring. Now, there is a connection. Some kids who get wheezy a lot might develop asthma later, but, and this is the most important word, most will not. The vast majority of babies who get bronchiolitis, even a pretty bad case of it, do not go on to develop asthma.
So let's just do a super quick recap of the big takeaways. Bronchiolitis is a virus. It mostly hits babies under 1. Antibiotics don't work. Your job is supportive care, especially fluids. The worst is usually over in about a week. It probably won't happen again, and it does not mean your baby will have asthma. If there is just one single thought I can leave you with, let it be this one. I know this illness looks and sounds scary, but for almost every baby that gets it, it's a short-term sickness that you can manage right in your own home, with them in your arms. Look, knowing what this is, knowing the timeline, and knowing the warning signs, it changes everything. It turns that feeling of fear into a feeling of preparedness. It gives you the power to care for your baby with confidence and to know exactly when it's time to ask for help. And hopefully, you feel a lot more ready to face whatever this cold season throws at you.